Welcome to the Yellow Trumpet. I am Chituga, and today our topic is how do we resolve our medical bills? How do we resolve our medical crisis? This is an important question. I know that over the years, the government has set up primary health care facilities, which we call our health centers here in Rivers State. Each ward is expected to have at least one health center which caters to the primary health care need of the society. In those days, when I was younger, it was the preferred place for treatment by our parents. That's where they took us because it was either free or affordable. Today, it no longer is free. I think it remains affordable to a degree because of the number of persons that I see there. A lot of persons show up there. The health center in my community is powered, do I say, or bankrolled by the Shell Petroleum Development Company. We are a host community. We host the residential area. Then there is another one, the Obio Cottage. Mine is Romocracy Health Center. Then there's the Obio Cottage at Oginiba. That's or Oginiba or Rumodumaya, Oginiba, I think. That hosts. It also bankrolled by Shell Petroleum Development Company, but that is a splash in the ocean. This is so because we have many complications, and even in this current situation, a lot of the drugs cannot be afforded by the citizens, the individuals in the society. We bring these drugs, we require it of them to pay, and they just don't have the income to afford it. They barely have enough to feed the family. Speak little of the income to afford these drugs. Where do we go from here? Who will sort this bill? Who will rescue the situation? Is it the local government, the state government, the federal government, or a philanthropist? Do we continue to revolve around welfare? These bills are real bills and people die because of it. A suggestion I would put out, especially as it relates to kidney issues, is these health centers should be able to afford at least a dialysis machine to carry out that procedure. There has been a lot of drug intake in society, a lot of alcohol consumption in society, and it has led to a massive impact. Now, government cannot close its eyes to the fallout of this because this drug use stems from unemployment, boredom. People have not what to do, so they are going for the next best thing, which is occupying their minds with substance. This substance has different effect on our organs, especially our kidneys. And you see that kidney issue is a major issue. So a machine for dialysis is important. Diagnosis is also as important. Prevention is also as important. But have we voted the sums required to bring this to pass? If we have voted the sums, have the sums been used for what they ought to be used for? This is no small concern. Well, if you are not ill, if you are not sick, and you have no close relative who is in their need of medical attention, it is obviously not an issue for you. But if you have relatives, if you have friends who are at the point of death, except they can experience these, will I say, medical procedures, then it becomes a major issue to you. So who picks this bill? I would argue, hard as it may seem, that government has to step up its responsibility. In particular, the state and local government has to step up its responsibility. It is important because what is society without citizens? It means nothing. What is Nigeria without Nigerians? It means nothing. We have to keep Nigerians healthy. That is the food they eat and the lives they live. That is a major influence. So influencing society is just as important, and then catering to the medical bills of society, primary health care bills. I know it's not free, but is it affordable? That's a question that I may not be able to answer. I've escorted a friend to get a doctor's report after he had a bite on his back. That cost him something. It wasn't free. He got a card. He consulted. The report was made. It cost him at least 6,000 naira. You may say small money, but to the persons living in a Bacha zinc house, is it small? That is his rent for the month. Is it small? It is worthy of consideration. And you may say, if you no fit build house, go your village. In the village where he lives, what kind of building does he live in? Is it a proper modern house? Or is it still not another makeshift? The problem is not moving people here to there. The problem is productivity. If in the village he were productive, if in the village his agricultural efforts is giving state support or at least local government support. These things are important because local government raise taxes, state government raise taxes. The question is, what happens to this IGR? What is done with it? To what purpose is it put? And so, I have not given you an answer. I have not given you a solution. I merely ask a question. Who foots the medical bill of society? I am Chituga Chinda. This is the Yellow Trumpet. Take care.